Good morning. Welcome back to the weekly morning meeting. Very big week this week. We decided not to do a guest speaker and instead to focus on all of the action happening at the State House this week. So, really excited to see so many of our partners on today. The way we're going to run this is essentially our policy team is going to go over the big picture, unfortunately, cuts that we've seen this week in the Ohio House's version of Substitute House Bill 96. And then we will have time for Q&A. If you've got stuff as we're presenting, let's keep this informal, throw it in the chat. I'll screen share a document here in a couple minutes that is high level and goes over each of these items, but we've got sources in the comp doc and the appropriate spreadsheet for everything. So happy to, I think a lot of you might already have this list, but we can, and we'll do our best to get to that. We've got at least 6 policy items we've got to cover right off the top, but we'll do our best to get to that. Um, so yes, please do keep putting questions in the chat and we will do our best to address them. So we have testimony happening today. Some of you might have already submitted public testimony yesterday. Lynn is going to testify from our team later this morning. And we know that the omnibus language for amendments is due today by noon. So if you are working with any legislative offices, I wanted to make sure that's a super, super time sensitive announcement to share. Please get those into your legislative champions by noon today. Finance Committee has already convened. Our whole policy team is on this call, but we've got other folks tracking it, streaming and in person. And there are a lot of witnesses. We have heard they are planning to cut things off by 5 p.m. A lot of the folks who are listed on this site will likely be submitting as written, but we know that there are a lot of folks who are over there in person right now as well. Um, that's kind of the process update. I'll pause in case folks have questions on process before we get into policy. There will be a committee vote anticipated on Tuesday. Unclear yet whether they'll be accepting more public testimony on Tuesday. But the floor vote is still anticipated for Wednesday. House leadership has indicated they are not planning to deviate from that timeline. So we can anticipate the bill moving next week. Senate hearings have already started this week. Child tax credit has already come up when the Office of Budget and Management presented to Senate Finance. So our team has been taking notes on their feedback around that provision. And I'll go ahead and kick off if there are not process questions to policy. So let me share this document that we've got that's a tracker of how governor's version to Senate version changes. Sorry, I have so many tabs open. That is desk season. Can you all see this chart? Amazing. Thank you for nodding, team. So I'm going to skip down a little bit. I'm going to pass it over to Troy here in a couple minutes to talk about the early learning cuts. We have shared a version of this that has even more things to track in it. But what I wanted to start on today was the big systemic cuts that we've seen so that we can really mobilize around some of the biggest picture items and then we can get into more. So I'm just going to quickly share, I'm sure you've all seen the news, the refundable cash back in hand for families, child tax credit for kids under age 7 up to $1,000 per child was removed. This has been removed in the House version of the substitute bill. That's a huge, huge loss. We will be pushing for it in the Senate. And in fact, we are still pushing in the House. So in addition to testifying today, Dominique is going to throw a link into the chat. We have an updated action alert now that we know what the House's cuts look like. This action alert will, if you put your address in and all that fun stuff, it will send straight to your legislator. I would highly, highly, highly encourage you to also take the content of that link that Dominique is sharing and put it in an email or a phone call to the Ohio House Finance Committee members. They are the ones who are going to be voting on the omnibus bill amendment in the full sub bill on Tuesday. So in addition to your legislators who will want to hear from you as a constituent, please, 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 if you have a couple minutes, try to do outreach to the House Finance Committee, and she'll also drop the link right there. She's so on it. Thank you, Dominique, to all of the House Finance Committee members, in addition to your own elected officials. If you are a constituent of somebody who's on finance, then your outreach is like doubly important. So please, please, please do check out that link. Even if you don't do it while we're on this call, open it up and save it for later. we'll be blasting it out today. It will be in our newsletter tomorrow. It will be on all of our social media channels. You won't be able to avoid it. We really hope that you click on it. So kind of biggest picture, broad brush is this for economic stability is the removal of the child tax credit. I apologize for scrolling around a little bit, but I'm going to go back up and we're doing this by department. So Troy, I think all of yours are in DCY. But if you need me to go to another department, just shout at me and I'll scroll wherever you need me to. But Troy's going to cover what are unfortunately the cuts that we saw to childcare expansion opportunities over the governor's version. So I'll pass it over to him.
Thank you so much, Brittany. I see some questions in the chat about some other ECE things that we can circle back at the end, but we want to make sure that we get through these high level cuts just so we can talk through and break down what those mean for kids and families. So two of the big investments we saw in the governor's version of the bill was the expansion of the child care choice voucher program that he announced in the State of the State and instituted in 2024, and the increase of eligibility from 145%, which makes Ohio one of the last states for initial eligibility for publicly funded childcare, to 160% of the federal poverty level. In this version of the substitute bill, we see the exclusion of that increase in eligibility, so maintaining at 145% of the federal poverty level and 150% for families with children with special needs. And then in the child care choice voucher program, it looks at like an expansion of $50 million specifically for the child care choice voucher program in each fiscal year 26 and 27. However, what it really does is restricts the ability of the child care choice voucher program to serve families. Right now, as of March of 2025, the child care choice voucher program was serving about 8,000 families from its inception in 2024 to now. This covers families between 145% currently to 200% of the federal poverty level. So families who do not qualify for publicly funded childcare initially, but are under the 200% federal poverty level threshold. There are similar requirements for the child care choice voucher program as there is for publicly funded childcare, meaning that families have to have some sort of work and or school training requirement to participate in the program. So it's supporting working families. But that 50 million really does just restrict. And to put it into context, the Department of Children and Youth in their red book had projected it would cost about 75 million in fiscal year 26 and about 150 million in fiscal year 27 to serve this program. In their prediction, that would serve about 29,000 children just through child care choice voucher program. So what that so we don't necessarily see a cut, but we see a restriction. We see they had projected it was going to cost 75 million and 150 million in 26 and 27, with scaling that restriction down to 50 million per fiscal year. It really restricts the ability to serve more kids. 29,000 is the projected number through the child care choice voucher program. So we see about $125 million restriction from being able to serve families. And in publicly funded childcare, that the moving to 160% would have served 11,000 more children. So we see a lot of restriction in being able to support working families in this version of the budget. Also want to look at the TANF block grant. That was historically, TANF underspend has been used to support publicly funded childcare when it was at JFS, and now it's at DCY. The numbers that were proposed in the governor's budget are very close to what historically has been spent on childcare. We see $150 million cut in each year, fiscal year 26 and 27. And that we see the $300 million cut in the substitute House Bill 96 in total DCY funds. So it's a huge cut, and it really limits the ability to serve those additional kids. So seeing here, that means 30,000 less children will have access to childcare due to these cuts in TANF and other spaces. And the other high level thing I want to point to is the kindergarten readiness assessment. This is it's the first and only marker that we have of children's academic readiness and school readiness when they enter into school. It's the first time we formally assess all children. It gives us insights on their ability to be ready. There's a lot of predictive studies on being ready for kindergarten, shows a higher percentage, like 7 times more likely for third grade reading guarantee, 9 times more likely to be proficient in math and language arts. We're all able to tell by the kindergarten readiness assessment, and the substitute bill eliminates the use of the kindergarten readiness assessment and the requirement for states to put it on their report card. I'll blow through really quick these other little items, Brittany. Imagination Library, we saw a proposal of an increase of 2 million per fiscal year. We see that increase decrease to sustain the levels in 24 and 25. And then science or reading, we saw in the governor mentioned this in his budget preview that to align learning, early child education learning development standards and use curriculum that was aligned with the science of reading. We see that entire requirement eliminated in this version of the budget. So with that, we will be available. I can answer some questions towards the end, but I want to bump it over to Caitlin to talk about Help Me Grow and infant vitality and some of the other Medicaid things.
Thanks, Troy and team, and thanks everybody for being here. Continuing to go in order of the document that you see before you, Help Me Grow is the first one. We know that currently there are vast numbers of families that would qualify technically for Help Me Grow home visiting services based on income, and it's like 8.8%, I believe. My documents aren't loading on my side, but only 8.8% of families who are eligible are actually able to access Help Me Grow. And so the Department of Children and Youth had called for a significant increase in Help Me Grow home visiting funding, up to 63,591,050 in fiscal year 2026, and then another jump to $85,521,869 in fiscal year 27. What we have found is that in this substitute bill, they reduced the increased funds that jump up to 85 million in fiscal year 27. They reduced that to kind of sustain the 63 million investment in fiscal year 27. It actually would be a decrease of so it would take it from the 63,591,000 and change down to 63,000 flat in fiscal year 27. I will point out that that is an increase of the funding that was enacted for fiscal year 25. We are currently seeing an investment of $55 million. So it is a slight increase. However, knowing that there are vast numbers of families, again, across Ohio that are eligible for home visiting services and unable to access them, seeing that disinvestment in fiscal year 27 is a concern. Moving forward to infant vitality, one thing that we really want to highlight for you is in the proposed budget, there was a call for appropriation of $7.5 million to be used specifically to support programming by community and local faith-based service providers to invest in maternal health programs, provide services and support to pregnant women. You've heard us talk quite a bit about the work being done by Cradle Cincinnati and Queens Village in Hamilton County that's seen significant reduction in the infant mortality data there in Hamilton County. And so one important factor here that community and faith-based service provision would have allowed for increased funding to really explore how we can leverage local community voices to address infant mortality at the local level throughout the state. And so we've seen in this newest version, the substitute bill, that they're reducing specifically the community and local faith-based infant vitality programming investment from the 7.5 million to 6 million each fiscal year. And then Brittany, if you wouldn't mind scrolling a little bit to the 0 to 3 continuous coverage, I want to be sure to hit that as well. As you'll see in the middle column in the executive version of the budget, there was no provision for this. This was enacted in law 2 years ago in the last state budget process to create continuous enrollment eligibility for young children ages 0 to 3 so that they are not disenrolled through administrative red tape and things like that. That program has yet to really get off the ground. We have been in the public comment process with the Ohio Department of Medicaid as well as CMS. And so what we have seen that was a surprise to us in the substitute House bill is that they're seeking to eliminate the establishment of this law, creating or requiring rather ODM to seek approval to provide continuous Medicaid enrollment for Medicaid eligible children from birth through age 3. So that was, again, that was a surprise. And since we have a little bit of time, I certainly want to carve out time for questions from the audience as well. I know we're blowing through a lot, but just to draw your attention also to the very bottom line there for doula services, this is another one where there was no provision in the executive budget. We have yet to see doulas be reimbursed through Medicaid for their services as this program is just getting off the ground. And in the substitute House bill, they have called to limit the current Medicaid coverage of doula services to the 6 counties with the highest infant mortality rates. And then also limit the total payments to $500,000 in a given fiscal year. So that significantly sort of undercuts the ability for doulas to receive compensation for the valuable services that they're providing. I will pause there. Brittany, is there anything else you'd like me to cover? Do we want to turn it over for questions?
No, thanks, Caitlin and Troy. I'll just briefly note that we've got a couple items from the Ohio Department of Health here that I won't spend too much time on, but all of the lead safe and lead abatement programming that is really critical for the 427,000 kids under age 6 in Ohio who live in housing that is potentially lead. Um, it could impact their health systems. It has all been cut. Everything has been zeroed out. And we've seen a decrease in the Tobacco Use Prevention, Cessation, and Enforcement Fund as well by 4 million each fiscal year. So those are included here. I noted in the chat, we will get this out to everyone. Troy and Caitlin, I know that was an insane amount of hundreds of millions of dollars of policy to cover. So I will go ahead and stop the share so we can turn it more into a Q&A conversation. But this is included in the link. If you click to today's Finance Committee witness list and go to Lynn Ann's testimony, this is included. We can start, since Ann kicked off the call with the question around ECE grants. Troy, would you mind answering Ann's question? And then we'll go to Ainsley next.
Absolutely. So I definitely know there's been a lot of talk about the changes in administrative practices and roles with ECE grant. From a budgetary standpoint, there's about $130 million in GRF funds that support that program. That was an increase in last budget. We see that sustained. So we actually see no cuts to the ECE grant program, which is a good thing. In a space where we're seeing money cut from eligibility for publicly funded childcare, we're seeing money cut in the childcare restricted in the childcare choice voucher program. The fact that we're seeing the historic investment that was made into this program sustained in this budget is a good thing. Where there are definitely challenges in the administrative of that grant program, the budget isn't necessarily the space to tackle that. The Department of Children and Youth, I'm sure, has continued to work and to refine that program, and they will continue to do that. But in a space where people are looking for things to cut, in a space where we're seeing funds, especially for one of the only and biggest GRF funded program for childcare and early learning services in the budget, it's a tricky situation to utilize this process to access. So I see some of your questions about not a cut in access, but restricted, less people able to access it. Definitely understand that. And I think as we think about the budget, that we can continue to revise and address administrative and rule things within the EC grant program. The Department of Children and Youth has been committed to continuously improving their practices and programs and listening to providers, but necessarily not wanting to bring attention or target a program that is not seeing any cuts in this budget and protect that investment of that 130 million per fiscal year.
Yeah, thank you, Troy. I think it's really an important note that we're not downplaying by any means the impact that you're seeing on the ground. We don't want to threaten the program additionally by raising a lot of attention in the legislature when things can be worked out with the agency. And I understand it's not that simple, but to just put it a little bit more, I hear you and I appreciate all of the comments. We've got a few other programs that we've got to talk about today, but opening it up to the legislature is, I don't think, going to do anybody any favors. I think it is very clear every single thing we've brought before them has just been slashed. So bringing this up to them during this budget process, they will see dollar signs and they will cut. So that is my recommendation. Ainsley has a question as well. You've had your hand up for a little bit, Ainsley, if you wanted to come off mute. Oh, that was it. Okay, no problem. I just saw it was up, it was flashing for a little bit and I didn't want you to be ignored. Other questions from folks? I know we have a lot of folks in the maternal health space as well on the call today. I see a question around cuts to school district funding. We are focused uniquely on kids birth to age 5, so we are not, we're looking at it from a big picture look. But there are other organizations that are focusing more specifically on that K-12 space, which is extraordinarily complicated and changing every single day. So I don't want to speak out of turn on that. Tiffany, I see your comment. Thank you. Yes, we were very disappointed to see disinvestment in the infant vitality space as well when our numbers are continuing to not move as quickly as we would like them to for babies reaching their first birthdays. I do want to plug, we can still take more questions. I want to plug Melissa briefly. She has some other ways that folks can engage if you are a parent or a caregiver, or if you work with parents and caregivers about how they can elevate their stories with policymakers.
Thanks, Brittany. Okay, so just a brief thing about the Family Action Network. It's a community of parents and caregivers working together to ensure families have a real voice in shaping policies that affect them. FAN elevates the lived experience of families to policymakers, helping drive meaningful change in areas like childcare, healthcare, early learning, and family economic stability. One of the ways I've been doing that is having Family Action Network monthly calls. These calls offer families a space to connect, learn, and engage in policy and advocacy. Each month, we spend 15 minutes on a key topic and 45 minutes for open discussion and resource sharing. This year, we've talked about what is advocacy. We talked about Governor DeWine's budget highlights, and we had an advocacy day reflections and upcoming opportunities. The next call is April 16th, and we'll talk about what we're talking about on this call is the cuts to the budget. And then we're doing a letter campaign. So we are collecting family stories that Troy and Caitlin discussed, and we're encouraging them to share their stories so we can send letters to their legislators, and we may use those on social media as well. So if you know a parent or you work with parents, or you can do the link in the chat that Dominique sent to share your story with us so we can get the word out about how these cuts are affecting families.
Thank you, Melissa. Do other folks have questions or maybe hopeful insights that they're hearing from legislators that we haven't yet about any changes as we look into the omnibus coming through the next few business days? Where are they putting the budget emphasis? That's a good question. They have spent in some they've cut all new revenue, which makes it a constricted, broader pool of funding that they can use to fund programming across the board. So we're not seeing much new in the way of spending, frankly. One big ticket item that many folks might keep seeing in the media is this Brown Stadium piece. That is a $600 million investment at this point. But largely, we're not seeing new funding, and we've been told that every amendment that we submit in the next week needs to be revenue neutral or to take away spending. So, to answer that question, sadly, I don't see they're putting much of an emphasis on anything new. Do we need the rationale or impetus for cutting the KRA? That's a great question, Margaret. We were frankly, I think this is something that we worked for many years before I was at Groundwork to try to implement as best practice policy. And we had not had a single conversation about it being at risk this cycle. And it kind of came out of left field, but we know there are some legislators that have been around that were always skeptical of implementing the program who happen to be in key roles. So that is one of the policy items that we know doesn't have a price tag attached to it to restore. So that's one of our top pushes in our advocacy efforts here this week. Have we been tracking these budget items against the closures of the regional Head Start offices? I wouldn't say necessarily against, but alongside, absolutely. Great question, PJ. We've been seeing those reports this week as well. But I think that's obviously more of a federal question. If Julie's on, I welcome her to speak about that too, but she might be in emergency mode right now herself. Is pre-K ELA on the chopping block as well? Troy, I didn't see that any of the budget language, did you?
Not by name. There is some cuts to early learning development standards in general, which include some of the required assessments, et cetera. We can follow up with more specific information on the pre-K ELA as we get more intel and understand the depth of some of these cuts in language.
Thank you. And thanks to Heather over at PMO for plugging the All In for Ohio Kids link too. For those who are interested in the K-12 funding changes, please click on that link in the chat. That's a great resource. Oh, there it is again. Awesome. Thanks, Heather. And we know, like, across the board, in addition to what we've, what ELDS cuts did you mention? I don't know. I think you're on mute, Troy. I'm
The
sorry.
science of reading curriculum. So it's in the governor's proposed budget, it required that early care and education learning standards be used to support states' early learning assessment work, required assessments and implementation of curriculum assessments that align with the science of reading. That's been a big important piece to the governor in supporting children's academic success and early learning experiences as they head into school. But we've seen some cuts around there, but more information to come as we understand what that looks like on the ground level.
And I know we're coming close on time. I do want to point out that the governor he created this budget that we were all very excited about. He is not done in this process. Just because it's in the House, it will move through the House floor to the Senate, and then all of June, most of June, some of June, depending on how they keep trying to be really timely. So maybe most of June, will be spent with like the big three negotiating. So the governor, speaker, and Senate president and their core finance chair and core budget staff. So Governor DeWine is still a part of this conversation. And I think it's really important that in addition to telling the House that we see these cuts and we're not okay with these cuts, and telling the Senate we want them to restore the governor's version, that we are also continuing in our advocacy efforts with the administration, with DCY, with the governor's office to say, we still support your budget. We want to do what we can to try to reinvest the dollars that you prioritize. So to the extent that you have relationships with regional governor staff or with DCY folks or with the governor's office directly, know that we're communicating with them regularly and we encourage you to do the same. Lori, thanks for your kind note in the chat. We really appreciate it. We've got 3 minutes left and I want to maximize. We have so many brilliant folks on this line who are working in this space. Are there other questions or ideas that folks have? Everybody's just numbed by this chart. Does my team have anything else they wanted to plug while we're on that I forgot? Yes, the chart will come out. Thanks, everybody. All right, well, we'll get that action alert out. You might have actually just gotten it while we've been on this call. We'll make sure that the action alert, the chart, and the recording from today go out. You've got all of our contact info. So please do not be shy about reaching out to us. And maybe we'll see some of you in committee or on social media continuing to pound the pavement as we continue trying to get our House to reinvest some of those dollars they cut back. Thanks to my team. Thanks to everybody else for joining in this morning. Be well.